Module 9 is Modular Integrated Undergraduate Curriculum. Physiology Sheikh Zayed Medical College Physiology Department. Dr. Sheen CEO and founder Medical Superfast Simplified Physiology Video Lecture Notes. Guyton and Hall 14 edition Lecture Number 18, Integrate with Pulmonology. Learning Objectives. Discuss Forced Expiratory Volume 1 Forced Vital Capacity FVC ratio in relation to pulmonary embolism. Forced Expiratory Volume 1 FEV1 and Forced Vital Capacity FVC are important parameters in the assessment of lung function. The FEV1-FVC ratio is a measure of airflow obstruction and is commonly used in the diagnosis and management of various respiratory conditions, including pulmonary embolism. In the conditions of pulmonary embolism, the FEV1-FVC ratio is generally not directly affected, as pulmonary embolism primarily affects the vascular system of lungs rather than the airways. Pulmonary embolism, PE, is a blockage in one of the pulmonary arteries in the lungs, usually caused by blood clots that travel to the lungs from the legs, deep vein thrombosis. This disrupts the blood flow to parts of the lungs, leading to reduced oxygen exchange and increased pulmonary artery pressure. The primary effects of pulmonary embolism are related to circulatory issues rather than obstructive or restrictive lung disease, which would more directly affect the FEV1/FVC ratio. In the early stages of pulmonary embolism, the FEV1-FVC ratio may be within normal range, typically 70 to 80% in adults. In the initial stages, pulmonary embolism may not significantly impact the airways. Normal FEV1/FVC ratio. In some cases, particularly in patients with chronic or recurrent pulmonary embolism, the FEV1/FVC ratio may be reduced. This can occur due to the development of secondary lung disorders, such as pulmonary hypertension or COPD, which can affect airflow. The reduction in the FEV1/FVC ratio can indicate the presence of airflow obstruction, which is not a primary feature of pulmonary embolism. In many cases of acute pulmonary embolism, the FEV1-FVC ratio may remain within the normal range, even though the overall lung function may be impaired. This is because the primary impact of pulmonary embolism is on the pulmonary vasculature, leading to ventilation perfusion mismatch and impaired gas exchange, rather than directly affecting the airways. It is important to note that the FEV1/FVC ratio alone may not be sufficient to diagnose or rule out pulmonary embolism. It should be interpreted in the condition of the patient's clinical presentation, risk factors, and other diagnostic tests, such as imaging studies. In summary, while the FEV1/FVC ratio can provide useful information about the impact of pulmonary embolism on lung function, it is not a specific or sensitive marker for this condition. A comprehensive clinical assessment, including appropriate diagnostic tests, is necessary to accurately diagnose and manage pulmonary embolism.